Welcome to this explainer. Now, if you are a healthcare executive, a CIO, or a care management leader, you absolutely know the operational bottleneck we're going to talk about today. We're diving into how Core Forms, powered by IT healthcare consulting, is literally transforming health risk assessments. It takes them from this manual, staff-heavy burden and turns them into a next-generation automated data engine. Let's jump right in. So how exactly do you scale HRA intake without just constantly adding headcount? Right? I mean, that is the multi-million-dollar operational question. Health risk assessments are these absolutely crucial, high-leverage tools for identifying chronic risk and closing care gaps. But let's be real. Traditional HRA programs, they're slow and they're incredibly resource-heavy. Care teams just get trapped managing endless spreadsheets and manual data entry across totally disconnected systems. And the reality is, this manual approach just breaks under scale. It starts leaking completions exactly where you need them the most. We've got to move away from that old paradigm. The traditional method completely relies on manual outreach, disconnected workflows, and this massive data entry burden. It basically leaves your staff doing logistics instead of, well, actual care coordination. But then there's the Core Forms way, and it represents a massive architectural shift. It uses automated omni-channel delivery to capture validated fields through a zero-friction architecture. Seriously, it's a real game changer. It takes what used to be a burdensome administrative task and turns it into a highly scalable asset that grows your volume without growing your headcount. Okay, so to actually pull this off, Core Forms acts as your central automation layer. Now, keep in mind, it's not just another form tool. It manages the entire HRA lifecycle from start to finish. We're talking initial outreach and intelligent intake, all the way to response validation and direct system handoff. By automating all these interconnected steps, Core Forms totally closes that critical gap between engaging a member and taking real clinical action. Now, the core of this whole architecture is intelligent omni-channel delivery. And the formula here is pretty simple. If you match the member cohort to their exact preferred access pattern, completion rates just soar. For instance, commercial members might prefer a secure web form sent straight via SMS. Medicaid adults, they often need SMS paired up with a phone follow-up. And Medicare Advantage or DSNP members usually respond best to frictionless, conversational phone interactions. Core Forms dynamically matches the intake strategy to the actual reality of the member. And that actually brings us to a piece of technology that truly sets this platform apart. We're talking about IPA, our AI phone assistant. Now, let me be super clear about this. This is not some rigid, robotic IVR system that frustrates people. IPA conducts fluid, natural language phone calls. It genuinely listens, it asks clarifying follow-up questions, and here's the crucial part. It translates those unstructured conversational responses straight into structured assessment fields right in real time. It doesn't leave your staff with messy transcripts to decode. It hands over ready-to-consume structured data. Plus, if we're being honest, reaching those hard-to-engage populations absolutely requires native multilingual scale. Every single intake channel in Core Forms seamlessly supports over 15 languages. We're talking English, Spanish, Haitian Creole, Mandarin, and a bunch more. And this isn't just a nice-to-have feature. It's a strategic necessity for health equity. Letting members respond in their preferred language dramatically reduces friction, and you capture highly accurate data across incredibly diverse populations. So here's how this whole workflow operates in reality. Step 1 is omnichannel outreach, which meets members exactly where they are. Step 2, intelligent intake, captures their responses dynamically. Step 3 is completeness validation, which is huge because it ensures no incomplete records clutter up your system. And step 4, structured data handoff. The intake data is instantly converted into clean, validated records. There is literally zero manual reentry. It's just actionable data flowing straight into your systems. Now for the CIOs and IT execs tuning in, we know your operations team does not want another disconnected app. Nobody wants a forced replacement project, right? Well, Core Forms is built on a low-disruption architecture. Using secure file-based workflows and bidirectional APIs, it injects clean data right into your existing care management and population health platforms. It's incredibly smooth integration. Absolutely no rip and replace required. All right, let's transition from the operational side to the clinical side, because at the end of the day, the ultimate goal of this data engine is clinical action. Core Forms uses configurable branching logic to identify chronic risks early on, things like diabetes, CHF, and COPD. It also provides entirely frictionless screening for social determinants of health, so it's instantly flagging things like housing or food insecurity. And when this validated data flows into workflows faster, your teams can step in and intervene way before emergency readmissions even occur. To wrap up this explainer, I really want you to remember this formula. Automated HRA delivery, multilingual intake, structured data handoff, faster action. Because the true value here isn't just about collecting forms. It's about building a scalable data workflow that actually reaches the right members and empowers your care teams. Coreforms, powered by IT Healthcare Consulting, makes this a reality today. So I'll leave you with this thought. Now that the friction of outreach and data entry is finally gone, are your operational systems ready to act faster?